So, welcome to At the Helm, the health podcast where we explore food as medicine and food as the treatment for chronic disease. I'm your host, Dr. Charles Helm. I'm a family doctor who, for more than 30 years, has practiced medicine in the remote rural town of Tumbler Ridge in northern British Columbia, in Canada, in the Rocky Mountains. I'm also a paleontologist with a PhD from Nelson Mandela University in South Africa. So really, Tumbler Ridge is the perfect place for someone like me. We punch way above our weight in health promotion here. We live in a UNESCO Global Geopark. We're a global hotspot for dinosaur tracks. We've got a very special museum. We've got 100 kilometers and more of hiking trails that begin right at our doorstep. And we embrace traditional connections with the land. We work very closely with our First Nations partners and from the region, all in the foothills of the Rockies. And I'm just really privileged to be hosting this podcast from the traditional land and territory of the Treaty 8 First Nations. Now, because I'm not only a family doc, but I'm also a paleontologist, I see things through the lens of geological time, and I'm really intrigued by the intersection of human health with evolutionary biology and how we improve the health of people living on Earth today, but also how things like geography, climate, ancient diets, traditional diets, how these things have influenced how humans evolved to eat, and not just to survive, but to thrive. Also, of course, how all these changes that we've seen in the last 50 years are really just a blink of an eye in geological time. So, what really worries me is what I call the three plagues of our time: type 2 diabetes, mental health problems, and dementia. There are others as well: autoimmune problems, rising cancer rates, all sorts of things. And for all these things, I'm really encouraged to know that a food-first approach, thinking of food as medicine, it works for the prevention and management of all these conditions, all these plagues. So I'm really encouraged by that. So over the course of this podcast series, we're going to try and chart a new course to health and wellness by examining how what we eat, firstly, may set us up for disease, but therefore also, and importantly, how changing what we eat can be as powerful or more powerful than any medication. So we'll be talking to research scientists who study the physiology of these processes in the lab. We'll be talking to clinicians who apply it in their practices, and we'll be talking to individual patients with some of the most amazing and inspiring success stories, telling us how changing what they eat changed their lives for the better. First, of course, there is a disclaimer. When I interview my hosts on this podcast series, we're not establishing a doctor-patient relationship. We're not giving direct advice. And especially for some of you who might be on prescription medications, for example, for type 2 diabetes, including insulin, if you're going to make major changes in your diet, which is a really good thing to do, you might well need, and probably will need, to significantly and substantially reduce those medications like insulin before you even begin. So we really recommend, please talk to your healthcare provider before you make major changes. So I'm just going to tell you a little bit more about my story and why I care so much about this topic. I trained to be a doctor at the University of Cape Town in South Africa. I graduated in 1981. I had some wonderful teachers. I absorbed everything I was taught, tried to apply it in my 40-year medical career for the good of my patients. Obviously, I supplemented my medical school training with continuing education over the years. And one example, which I was taught and which we pursued with almost religious fervor, was the low-fat diet and how fat was demonized in the diet and how we aimed to reduce blood cholesterol, serum cholesterol, for just about anybody who had even mildly elevated values, whether or not they'd had a previous heart attack or stroke or event, cardiovascular event. And so almost unquestioningly, I believed what I was taught. I certainly prescribed my share of statin drugs for primary prevention, of cardiovascular disease. I certainly prescribed my share of insulin for type 2 diabetics without really thinking of the consequences. And just as I was taught to do, I piled on more and more medications, finishing with insulin. But the longer I practiced, the more I began to question what I was doing. As I learned about things like NNT, the number needed to treat, which is the thing we really should be talking to all our patients about before we recommend going on to new medications. And I began listening to my patients who told me, Doc, the moment you put me onto that insulin, I started gaining weight and I can't lose it. I can't win for losing, is what they told me. And they were right. And in retrospect, I realized we were taught next to nothing about nutrition in our medical school training. And I'm still astonished by how few of my colleagues ask as a first question when they meet a new patient, so what are you eating? How do you cook? Anyway, the problem is that once you think you've got it all figured out, that's when you quit. So I'm now a semi-retired family physician. But as I semi-retired, I knew there was unfinished business that I had to attend to. So when I learned about IPTN, the Institute for Personalized Therapeutic Nutrition, and the work it is doing, I realized here was an opportunity to address and redress the things I'd gotten wrong in my career. Look, I mean, the mistakes I made were made with the best of intentions, but they were errors nonetheless. And I learned that IPTN, in addition to advocating a simple food first, food is medicine approach, doesn't prescribe really what kind of diet people should follow. It respects people's individual choices. It could be vegan, vegetarian, ketogenic, carnivore, paleo, Mediterranean. I mean, the common theme is that one aims for a low carbohydrate diet, yes, but otherwise, it's just whatever works for you is good. And it's all really scientifically based eating. And the goal, what can be more laudable than trying to put diabetes type 2 into remission? This also then provides a lovely antidote to the what's called the diet wars. You know, we see all this antagonism between, for example, vegan and keto. That sort of seems to be one of the main areas of the warfare. And this consumes so much energy. And my feeling is really we need to end that and we need to channel that energy into some real battles, which really are important. So anyway, the plagues that I've mentioned, those three plagues, type 2 diabetes, mental health disorders, dementia, to which we can add other chronic diseases. These represent a failure of the conventional mainstream approach over the past 50 years and more. There are so many of my colleagues who are trying their best to address these plagues in numerous ways. But I've heard it said one of the definitions of stupidity is just trying harder and harder and harder to do the same thing, hoping that one day it's going to work. Well, it ain't going to work. We have to change things. And the way I see we change things is by going upstream as far as possible. Because unless we go as far upstream as we can, the solutions will not be transformative and they won't be durable. And upstream for me means addressing what we put into our bodies, how and what we eat. It all starts with food, in other words. And IPTN can be the catalyst to help us to get ahead. So I live in the mountains in a remote community of 2,500 people. I'm also passionate about how rural communities can lead the way in transforming healthcare. So if we think about type 2 diabetes reversal or remission, for example, in Tumbler Ridge, where I live, we have one grocery store, a handful of restaurants, one high school, one elementary school, one community garden, one community kitchen, one major employer. It is orders of magnitude easier for us to achieve success with type 2 diabetes remission here than it is in an urban area. So we can try and get things right here and then export the solutions elsewhere. Because if we can't get it right, no one can. So I'm really proud of my medical colleagues who have helped to make Tumbler Ridge a pilot site for type 2 diabetes reversal. I can put it simply, in Tumbler Ridge, we're going to build a community about type 2 diabetes remission. I'm also so privileged to be working very closely with our neighboring First Nations. for many reasons, but one of them is that our First Nations, our indigenous populations really bear the brunt of type 2 diabetes, even more than what I see here in Tumbler Ridge. I'm told that up to 80% of adults are afflicted with type 2 diabetes or pre-diabetes. It's not a question for these indigenous folks of if, but when. It's not, will I one day maybe get diabetes? It's when am I going to get my diabetes? And that's an absolute tragedy. And we are really going to try to offer hope to these communities in the face of this awful statistic. And when I look back on the past decades, 50 years ago, there was so much hubris, so much arrogance. People were so sure they had it right. And if we look back, the evidence was there to the contrary, but people had agendas. So we weren't always right. And it really is time now to replace that hubris with humility, a suitable dose of humility. And we can acknowledge that we know a lot more now than we did in the 70s, but we still don't know everything. Things could still change. And I really try not to be naive in this. I fully understand the enormity of the challenge ahead, but I also know that if we don't try and do something, failure is guaranteed. And the stakes are high. I mean, these chronic problems, these plagues, they've got the capacity to bankrupt our healthcare system and even bankrupt our society. These are serious problems. So the goal is simple. We want people to live as long as possible, as healthily as possible. For me, seeing food as medicine offers a unique and a viable way forward, because I know that if any pill, any medication offered the benefits that healthy eating does, people would be lining up in droves to get it prescribed for us. I know how many people really want to learn about this and to do what is best for their bodies. Our challenge is to listen to such people and to try and inform them and give them the best scientifically based evidence that we can, in the hope that a food-first approach actually becomes mainstream. And that challenge is what motivates me to host this podcast series. And I hope you will enjoy learning more about these topics with me in the podcasts that follow. I do want to thank Anne Mullins, our producer, Graham Wheeler, our technical whiz, our technical guru. I want to thank IPTN, the Institute for Personalized Therapeutic Nutrition. I also want to thank RCCBC, which is an organization I represent, the Rural Coordination Center of BC, which does wonderful work. Once again, I am Dr. Charles Helm. You have been listening to the initial introductory segment of this podcast series, At the Helm. Hope to see you again soon. Thank you.